What do we have today?
Hello, good morning everyone. Dr.Mohebi. We have a day of consultation today. A few good patients today. We're going to go over some interesting cases that came back for follow-up appointments. Go over the weekly schedule to tell everyone who's following us what's going to be happening for the week that we have ahead of us. We have a small FUE for doing temporal points only. This is a patient who had a hair transplant before and now he wants to get the temporal points. So on Thursday we have a FUE procedure, a traditional 2000 FUE from back to frontal area. Today we have a celebrity FUE. A celebrity FUE is a procedure that we don't even shave the back, so we cut individual hair and extract them. A patient who had another procedure before and now he wants to do fine-tune it and put more density and more filling on the corners. Today we also have this procedure because it's an open house day that we have. People who are local, they can come to open house on Saturday. FUT or strip procedure, a small one to do the corners, the front, and hairline. This is a gentleman that we did last week, 2 weeks ago. He's coming back for follow-up. He did the FUE in the frontal area of the scalp. This is the area in front that he was missing. We went between the corners, the thinning areas, and this is right after. You see how densities, the scabs are gone. This is how you expect to be 2 weeks after procedure. It looks like you have full head of hair. The scabs are gone. You see the front and corner. See how natural the hairline is? That's how expected to be after a FUE procedure in the frontal area. This is before and this is after. FUE hair transplant, this is how you look before procedure or something similar to that. This is the day 1 after procedure. And this is 2 weeks after procedure. Let me show you how natural looking a hairline should be after a FUE procedure. This is like just 2 weeks after procedure. You still see some redness, but it's looking pretty natural. And this is how your donor area looks. Only 2 weeks after procedure, there is no sign of any procedure visible here today. Nothing detectable. The procedure that I have seen the patient for 6 months after procedure was this gentleman with extensive hair loss in front, top, and crown. The forehead, this is the front. What you can see, the temples are gone, the front are gone. This is the top, and this is the crown with the big balding. Let's see how he looks right after procedure, 6 months after his procedure. This is him after procedure. Nice and dense, good quality. Look at the temporal points here. Temporal points are very important. This is before and this is after. Nice and natural. The temporal points are very important in the youthfulness of the face. So even if you do a very good job in front with frontal hair restoration, if temporal points are receded like what it is here, patients still look old. The baldness might be taken care of, but the patient still doesn't look that youthful. Hair. A big hair loss, right? Front, temple, top, and crown. See how it looks after procedure. There it is. Nice and dense frontal hairline. Top, crown still probably can use some hair. Looks pretty solid. Definitely better than what it was before. Before and after. I'm going to talk about is this gentleman who had this frontal recession and corner thinning, and he had more than one procedure because he wanted to have a perfect solid hairline like this. This is the density that he got after a few procedures to reinforce the front. Of course, they were in smaller procedures, but we managed to give him a good density in front, and temporal lines are looking pretty solid.